So in this procedure, we're using fat grafting to really accentuate the different areas of the face that we believe need some volume and in general improvement overall. A big part of facial rejuvenation is the use of fat. Fat grafting to the face gives you better volume in the areas and sometimes even improves skin quality depending where you're injecting it and how you're processing it. So pretty much all my facial rejuvenation procedures include some portion of fat grafting. In this procedure here, we are processing the fat in different ways. The first part of the fat is I remove the fat from usually the inner thighs or the belly area, and this depends on the patient. And I take this with very, very fine cannulas. Once I have the fat in these syringes, it's still not purified, so I make sure we put this in the centrifuge. The centrifuge is going to spin around the fat for about 4 minutes. And this allows the different components of the fat to separate from each other. As you can see here, we have a component that's pretty much blood. The top part here is a lot of the fat without any fat cells. And then here, this area includes, or the nice yellow area includes fat that is what we want to process and we want to inject back on the patient. We continue processing this and we lay this on these special sheets. With these Telfa pads, we are absorbing excess components that we don't want to inject back on the patient. And we want to keep on purifying the fat. Finally, we pass the fat through this special filter to make it smaller and have the particles have a little bit less viscosity and allow this to graft better on the patient. If I'm injecting fats in the lower eyelid, I use what we call nanofat. And this is some extra processed fat that has very, very, very tiny molecules basically that allows the fat to take better in this area and not over volumize, and really it's much more pure for this area. The reason for this is that in the lower eyelid, everything's so thin and you don't want to feel little fat globules after you're done with the fat grafting procedure. Nanofat also has stem cells in it that restores and improves the quality of your skin in that area. In general, of the fat that we inject in the face or anywhere else on the body, about 60 or 70% remain in place and the rest your body reabsorbs. So it's very important how we process the fat, and that's what's key. In general, we have to avoid damage to the fat globules or the fat cells, and we got to keep the integrity of these as intact as possible. It's also key to remove any impurities with this process of purifying the fat to allow what we're injecting to be as pure and the best material possible. So here the fat is already processed and ready to be injected in the patient. Now we change to these really small syringes, and the reason for this is I want to inject this in very, very small aliquots. The smaller the aliquot and the better spread the fat is within the face, the better the take will be. So it's very important to do this, taking your time doing it and really allowing for full volumization of the areas that you want to achieve. So fat grafting in general has revolutionized many areas of plastic surgery, body, breast, and in this case, facial rejuvenation. Facial rejuvenation with fat grafting is a very, very powerful combination. And it's not just about lifting and repositioning tissues, but also volumizing what we've lost during the aging process. Fat grafting has revolutionized facial rejuvenation surgery. So this is not just about lifting and repositioning tissues, but it's also very important to volumize the areas that have been lost as we age. With fat grafting, we're allowed to do this in a way that's natural and something that's long-lasting. If you have any questions, leave it in the comments below.